Sexuality in old age is a subject often surrounded by taboos, but it is essential to address sexual well-being as an integral part of health at all stages of life, including the elderly. From a scientific perspective, there is no universal, ideal frequency for sexual relations in older people, since sexuality depends on many factors such as physical and mental health, relationships, personal desires, and emotional well-being. However, various studies have pointed out that maintaining an active sex life can contribute to a better quality of life, promoting cardiovascular health, self-esteem, and emotional well-being. Instead of focusing on the number of times you should have relationships, the key lies in the quality of sexual experiences and open communication with the couple. Lubrication, for example, can be a relevant aspect in the sexuality of the elderly, due to hormonal changes. But there are solutions such as water-based lubricants that can facilitate sexual act and make it more pleasant. In addition, research has shown that physical contact and intimacy continue to be a source of pleasure and emotional connection for many older people, regardless of frequency. The most important thing is that people feel comfortable, safe, and accepted in their desires and in their bodies, and that sexuality is practiced in a consensual, respectful, and healthy way. Sexuality in old age should not be seen as something reserved only to youth, but as a valuable and natural part of life that can continue to be enriched and transformed over the years, provided that healthy habits, communication, and an attitude are maintained positive. It is crucial to understand that, over the years, people may experience changes in their libido or their sexual needs, but this does not mean that sexuality should be excluded from everyday life. Instead of thinking about sexuality as something that decreases with age, it should be considered as an evolutionary part of adult life, which adapts and changes according to the desires and limitations of each individual or partner. As we age, sexuality can become a more emotionally connected act, where intimacy and love become as important as physical pleasure. In addition, maintaining an active sex life in old age is associated with an improvement in cognitive function and a decrease in stress, which favors general health. It is important to remember that not all older people have the same vision or desires regarding sexuality, so the key is an individualized approach. Opening and understanding by couples are essential to explore new forms of intimacy, adapted to mutual needs and desires. In some cases, the use of medical therapies or treatments can be useful, such as those destined to improve sexual function, which can help those who face health-related difficulties. However, dialogue and empathy remain the most powerful tools to promote healthy and satisfactory sexuality. Finally, promoting a positive attitude towards sexuality in old age helps eliminate stigma associated with the idea that sexual desire decreases or disappears with age. Actually, old age can be a stage of rediscovery and openness to new experiences, where mutual well-being and respect play a fundamental role. By focusing on enjoyment and understanding of changes, sexuality in the third age can be as rewarding as in any other stage of life, demonstrating that age is not an obstacle to an active, healthy, and full sexual life. In addition, it is important to recognize that, with age, physical changes can influence how people experience sexuality, but this does not have to be an impediment to enjoy a satisfactory sex life. For example, the decrease in hormonal levels in women during menopause can lead to changes in vaginal lubrication, which could make sexual relations less pleasant if appropriate precautions are not taken. In these cases, the use of lubricants and other solutions recommended by health professionals can be key to maintaining an active and painless sexual life. Similarly, men may experience a decrease in erectile function, but this can also be handled through medical treatments or adaptations, such as the use of erection devices or specific medications. In addition to physical factors, emotional and psychological aspects also play a vital role in sexuality in old age. Trust in the couple, open communication on desires and limits, and respect for the emotional needs of the other are fundamental to maintain a satisfactory sexual relationship. It is not just about fulfilling a certain frequency, but to create a safe space where both members of the couple feel comfortable exploring their sexuality and maintaining the emotional connection that goes beyond the physical. Sexual well-being is also closely linked to mental health. Stress, anxiety, and depression can negatively affect sexual desire, so maintaining an integral approach to health is essential. Promoting activities that reduce stress, such as exercise, meditation, and socialization, can have a positive impact on libido and the quality of sexual relations. The relationship between physical and emotional health in old age is so crucial that, in many cases, improving general well-being can result in a rebirth of sexual life. Finally, it is essential to eliminate the wrong idea that sexuality is exclusive to young people. Older people also have the right to enjoy their body and desires. Sexuality in old age is a natural component of human life, and it is crucial that, as a society, let's continue challenging the prejudices and stigmas associated with this issue. In doing so, we not only improve the quality of life of the elderly, but also encourage a more inclusive and respectful culture with all aspects of human existence. Sexuality is a part of life that should not be lost over time. On the contrary, it can remain a source of satisfaction, intimacy, and well-being. The importance of promoting a positive attitude towards sexuality in old age also lies in how other areas of life, such as physical health and longevity, sexual intimacy, like other forms of physical contact, has beneficial effects on the health of the cardiovascular system, the liberation of endorphins, the reduction of pain, and the improvement of sleep. These benefits do not disappear with age. In fact, maintaining an active sex life can contribute to greater vitality and well-being. The practice of sexual relations can increase blood circulation, which improves the oxygenation of tissues and the functioning of organs, which favors healthy aging. Sexuality is also intrinsically related to self-esteem and the sense of identity. As people age, some may feel that their physical attractiveness decreases, which could generate insecurities or affect their perception of themselves. However, maintaining an open attitude towards sexual desire and the exploration of new forms of intimacy can strengthen self-esteem and helping older people feel that their body is still valuable, desirable, and capable of providing pleasure. The acceptance of the body itself, regardless of the changes that it experiences over the years, is key to enjoying a satisfactory sex life. If you like this type of videos, Don't forget to subscribe to the channel so you don't miss more videos like this.